Why do I need to take a coach safety class? When I played, we just rubbed some dirt on it, got back into the game. I just want to coach. You don't think it's going to happen to you. You hear about it happening a million miles away to somebody else in another state. You don't know the situation. You never think it's going to happen to your kids or even anyone you know. Welcome to Rub Some Dirt on It. Let's keep in mind a few things. First, nearly all the causes of death in sport are influenced by the care provided in the first 5 to 7 minutes. In youth sports, kids ages 5 to 14, there are rarely, if ever, sideline medical personnel. The best emergency response times are 7 to 9 minutes.
I'm open! Guys, are you okay? Max, are you okay? Okay.
What happened? Was it sudden cardiac arrest, an asthma attack, anaphylactic shock, hypoglycemia, heat stroke? This was a practice. You are alone. What do you do? Let's get prepared. Preseason preparation, what do parents need to do? Emergency action planning, sudden cardiac arrest, heat injuries, brain injury, asthma, anaphylaxis, skin issues, bleeding, and seizures. Let's go. Preseason parent responsibilities, the pre-participation physical exam. 27 states require the use of outdated or unidentifiable forms. 10 states have not updated their forms in over 5 years. Only 1 state requires a PPE for 8th grade athletes, 13 for 7th grade, 10 states for 6th grade. And what about leagues and clubs? Almost 0. What is the most recent update of this form? 2019, the American Academy of Pediatrics updated the form. Make sure that is the form that is used when you get the PPE. All the links will be in the information box below the video. Preseason physical preparation. What has your child been doing all summer? Have they been indoors all summer? Have they been training? And we mean really training for at least 8 weeks prior to that first practice? Do they have any physical limitations which you need to be aware of, the coaches need to be aware of? These are all questions that should be asked and answered well before the beginning of the first practice. Take an E, emergency action plan. Who is responsible for providing on-the-field care? Who manages the rest of the team? Who manages the spectators? Who calls 911? Who meets the ambulance? Where do you meet the ambulance? Who travels with the injured athlete? Who gets the AED? Where is the AED? Does the organization have an AED? Same for the first aid kit. Who notifies the emergency contacts? Who documents the injury? Is this information immediately available to you, the coach, on the sidelines? When it comes to 911, if you're not sure whether the situation is a true emergency, officials recommend calling 911 and letting the call taker help you determine whether you need emergency help. Never, ever, ever not call 911. Sudden cardiac arrest. Sudden cardiac death is the leading cause of death in exercising young athletes. In the U.S., a young competitive athlete dies suddenly every 3 days. Young athletes are more than twice as likely to experience sudden cardiac death than young non-athletes. 1 in 300 kids has a heart condition that puts them at risk for SCA. The chances of survival decrease by 7 to 10% for every minute that passes without CPR and defibrillation. And remember again, the best emergency response times are 7 to 9 minutes. So what do? You get that preseason cardiac screening. You make sure the organization has an AED. You call 911 for help, start CPR, and restart the heart, hopefully with that AED. Are all the coaches trained? This is what you must have in place as your sudden cardiac arrest plan. On the left, Corey Stringer. He died in 2001 from heat stroke. In 2010, the University of Connecticut founded the Corey Stringer Institute. Yet, in 2018, Jordan McNair died from heat stroke at the University of Maryland. Let's prevent this from ever happening again. Pre-participation physical examination questions. Have you ever been diagnosed with heat stroke or heat exhaustion? Have you ever had trouble exercising in the heat? What has been your preparation the last 2 weeks and the last 2 months prior to the very first practice outside? What are your drinking habits? What's your hydration status on a regular basis? Are you a salty sweater? Are you getting enough sleep? Are you taking any medication or supplements that might impede your ability to deal with the heat? Does the athlete have sickle cell trait? This is extremely important to know because it does potentially increase the susceptibility to injury due to heat exertion in the heat. It does not mean you cannot compete. It means that you have to dot every I and cross every T when it comes to your physical preparation when you're in the heat. Here's one thing that can help you determine your regular hydration status. What is your urine color? It should be light yellow. If it is deep dark brown after a workout or on a regular basis, that is of concern. It needs to be reported and managed. Coaches, administrators, do you have a heat plan? Meaning, are you going to record either the temperature, the heat index, or use a wet bulb globe thermometer to record the heat for each practice and each game? This way you'll be able to take attendance, know which kids are there, which kids are absent, and what the temperature reading was for each outdoor activity, and then make your determination red, yellow, green, or even black as to whether or not you're going to compete outdoors, how hard you're going to compete outdoors, what clothing you're going to wear outdoors. Very important to have that plan and have it documented for each session. What are the signs and symptoms of heat illness? Even the calmest person can become irrational, irritable, emotionally unstable. Not their fault. They're going down the road of heat exhaustion to heat stroke. Altered consciousness, coma, dizziness, headache, confusion, just looking out of it, nausea, vomiting, diarrhea, muscle cramps, loss of muscle function, inability to walk, staggering, collapse, sluggish, sweating or dry skin. Their performance is going right down the drain. Dehydration, rapid pulse, low blood pressure, quick breathing. You must pay attention to your athletes, coaches, and each athlete should have a buddy. Pay attention to each other's performance. What do you need to do if you see these signs and symptoms? Cool first, transport second. It's really very easy. You need ice and you need a tub of water. There's 100% survival if you start cooling within 10 minutes of noticing these signs and symptoms. Cooling is approximately 1 degree every 3 minutes, and it's very important to time how long the athlete is in the tub. You're going to be calling 911. If you don't have a tub and ice, at least have ice bags. Place them around the head and neck, the armpits, and the groin. And one other issue with regard to the heat and training hard, it's called rhabdomyolysis. It's a fancy way of saying extreme muscle pain and damage. Muscle pain and soreness, tenderness, weakness, joint pain, swelling, nausea, dizziness, fatigue, vomiting, confusion, fever, rapid heart rate, and that dark cola-colored urine. You need to call 911. If the athlete is unresponsive, then you need to start CPR, But the main thing is to follow the heat guidelines that we just laid out. Football gets most of the attention when it comes to talking about concussions, yet this paper says concussions now account for a higher proportion of injuries in girls' soccer than boys' football. What does a concussion look like? Let's take a look at the brain in a concussion. You can see the shaking back and forth inside of the skull. So there's damage inside the skull from the brain banging around into the skull, but there's also damage deep inside the brain as well. In 2016, world experts got together for the 4th time to issue their consensus statement. So next year in 2020 will be the next consensus meeting. As of this consensus statement, the definition of concussion: it's a brain injury. It's caused by a direct blow to the head or other part of the body. Symptoms can occur quickly or be significantly delayed and may be short-lived or last a while. You don't have to be knocked out to have a concussion, and you probably won't see the damage either physically or via an MRI. When we use the terms ding, bell ring, or head injury, blow to the head, brain injury, hard collision, he got popped or smoked, impact event, all these mean a concussion. So what are we looking for? We have signs. Did you notice a hard collision, a loss of consciousness? Were they slow to get up? Were they unbalanced, unsteady? Did they fall back to the ground? Were they holding their head? Did they look dazed and confused? Did they have that blank or vacant look? Did they have a facial cut or bruise or bleeding? Did they have a seizure? Is there a change in behavior? Did the athlete vomit? Were they irritable? Were they unable to stop crying, especially in younger kids? Were they answering questions very, very slowly? That is what you notice, the signs, your observation skills. Then what did the athlete report? The symptoms: headache or pressure, neck pain. Do they state that they feel like they're going to vomit? Do they say they have nausea? Are they dizzy? Is their vision blurry? Is their vision double? Is their speech slurred? Do they state they have radiating pain down their arms or legs, numbness or tingling down their arms or legs, sensitivity to light, sensitivity to noise? Do they say, I don't feel right, I can't think clearly, I feel sluggish or groggy, I feel tired, I feel nervous, I feel sad? And is there memory loss? Very simple. When in doubt, take them out. When in doubt, take them out. What are the emergency signs and symptoms? Is one pupil larger than the other? Is there drowsiness or an inability to wake them up? Do they have a headache that's getting worse? It's not going away. Are they experiencing that weakness, numbness, or decreased coordination in the arms and legs? Do they have neck pain, tenderness to the touch, an inability to move their head around, loss of range of motion, dizziness, repeated vomiting or nausea, convulsions, seizures, a change in behavior, confusion, restlessness, agitation, combativeness, slurred speech, unable to recognize people or places, less responsive than usual, will not stop crying, cannot be consoled. Any loss of consciousness, even a brief split second, is considered an emergency. Which of your athletes has asthma? Do you know? What are the signs of respiratory distress? Struggling to breathe, nostrils flare, significant coughing, difficulty talking, wheezing, gasping, the ribs flare, chest tightness, lips, fingernails can get grayish, bluish, confusion, difficulty walking. What medications does the athlete need in case of an emergency? Every 10 seconds, someone has a potentially life-threatening asthma attack. 90% of asthma patients do not use their inhaler correctly. If there's severe breathlessness, call 911. Basically, shake the inhaler, spray into the mouth with one spray, and continue to breathe in. Hold the breath for at least 10 seconds, let it all out, and wait 60 seconds for a second puff if needed. Inhalers can be different shapes and different sizes, so it's really important to review proper use with coaches and parents. You also need to decide, are you going to allow the coach to administer the inhaler should you not be present? These are all discussions you must have before the start of that first practice.
Yeah, you better give yourself a shot.
Yes, anaphylaxis is very scary, but as you see, if you have an EpiPen, it can be taken care of very quickly. The top of the EpiPen, there's a blue safety release, and you must remember orange to the thigh, blue to the sky. And notice how the person is holding the EpiPen, thumb to index finger. Do not put your thumb on the top of the EpiPen, because if you hold it upside down and you put your thumb over the orange top, you don't see the needle. But if you put it into the person's upper outer thigh, the needle may actually be going into your thumb. It's very important to review EpiPen use with those athletes and coaches and parents. Get them all on the same page if the athlete needs an EpiPen. And by the way, you need to have 2 EpiPens because you might need to provide 2 doses. Have this discussion before the first practice. When athletes share infections, well, hopefully they won't after this presentation. What does MRSA look like? Methicillin-resistant Staphylococcus aureus. It's ugly, it's red, it's oozing. If you see something like this, please pay attention. What are you going to do? Don't touch it. Remove the athlete from play. Contact the parent. Please make sure you have your athletes wash their hands before and after playing sports. Do not share any items that come into contact with the skin, like bar soap and towels, and make sure if the athlete does have a diagnosis of MRSA that a doctor's note is documented for return to play. Bleeding. If you have a severe bleeding event, number 1, preparation. Do you have proper gloves? The first rule of rescue is don't hurt the rescuer, so you must have gloves. You can buy gloves at Home Depot. You can buy gloves at Walmart. Football coaches, some of you are big. If you have large hands, make sure you have proper size gloves that fit. What do you want to do? You also want to have gauze pads. You are going to apply direct pressure, if necessary with just your hand, preferably a gloved hand with a gauze pad. Apply the dressing, press and hold, and in a very severe bleeding event, you need to learn how to use and have a tourniquet. For nosebleeds, squeeze the nostrils together for 5 to 30 minutes straight. Yes, that can be a long time without frequent peeking to see if the bleeding is controlled. Usually 5 to 10 minutes or even less is sufficient. Keeping the head elevated but not tilted way back is important, because the tilted way back position may cause bleeding into the throat and lungs. If you just hold the pressure and don't peek, it will work the vast majority of the time. Seizures. You must know whether the athlete has had a history of seizure disorders. You may not know, however, if the athlete has never had a seizure. If you see a seizure, call 911. What you must do is cushion and protect the head, because the head may be pounding. If you're on concrete or another hard surface, that can be very dangerous. Move harmful objects out of the way. Don't restrain the athlete and don't put anything in their mouth. If you can, time the seizure. How long does it last? That information is very, very important for the doctors. If the athlete becomes unresponsive, you'll start CPR. After convulsions stop, turn the athlete on his or her left side. Remain with the athlete until the ambulance arrives. And we'll end with this list of supplies for a first aid kit. Please put these safeties, procedures, and protocols into place before the start of the first practice for your sports season. It is so important. We want this to be a way for you to be organized and for everybody to be on the same page. Be safe, have fun, play sports.
I sort of just sit there secretly hoping at the end of every game that they walk off the field in one piece.